A lot of patients who come to me for hip pain may actually have a hidden back problem, so really need an x-ray to see if they have true hip arthritis. Some patients just have bursitis, and that can be cured or treated with just an injection. Other patients may have a back problem or a problem in their sacroiliac joint, causing posterior pain behind the hip. When they have that, they really don't need a hip replacement. If somebody has groin pain and they've got x-rays that show hip arthritis, those are the type of people who are candidates for hip replacement surgery. When you have arthritis of the hip or knee or any joint, ultimately something may have to be done like an operation, but there's ways of putting that operation off. We specialize in doing fluoroscopic guided steroid injections for hip arthritis, and people can get up to a year relief with that. If they get a year of relief, we see how they do with another injection. Sometimes people come to us and think they need a hip replacement when really all they need is an injection. Hip pain is a very disabling kind of pain. It prevents people from standing or walking. They can't do sports. Sometimes it interferes with activities they've enjoyed with their spouse in the past they can no longer do. In a hip replacement operation, we're basically replacing the hip. The hip is a ball that sits in a socket, and you put in an artificial socket with an artificial ball. It takes about an hour to an hour and a half. It can be done either with a computer or with fluoroscopy, which allows us to image the hip during the procedure. By imaging the hip, we can make sure that the implants are in the position where we want them. Typically, patients are in the hospital for 2, maybe 3 days. Half of them will go home, half of them will go to rehab. Recovery time can differ from patient to patient, but a general rule of thumb is that most patients are 40 to 50% better at the end of the month. At that point, they're off a walker, perhaps using a cane. They're taking some pain medication, but not as much as they were during the previous month. By the end of 2 months, they're 80 to 90% better. Lifetime of hip replacement is variable. If somebody's more active or younger, they tend to have a shorter life experience for their joint replacement. If they're heavier, that can also affect the results. Typical results are 20 to 25 years. I've operated on patients as old as 99 and as young as 26. You can have hip problems for various reasons. Arthritis tends to occur in older adults, but it can occur in younger adults as well. But they can have other problems. They can have congenital hip problems, or they can have a condition called avascular necrosis, which involves the blood supply. When the blood supply is injured, the hip will become arthritic. If somebody has hip pain and they think they might be a candidate for a hip replacement, or they just want to find out why their hip hurts, they can certainly come see me at the office, or they can go to my website where there's sources of other information.